Have you been injured, had an MRI, or feel like you need an MRI? Have you been told everything looks normal if you've had an MRI and yet you still hurt? You're not alone. Let's discuss the role of MRIs as it relates to neck and back pain in this two-part series. Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and fellowship trained in primary spine care. In addition to my training, education, and experience, MRIs is a common tool that I've used for managing patients with neck pain and back pain for decades. Now, please remember, these videos are not a substitute for professional medical or chiropractic advice, for diagnosis, or for chiropractic or medical treatment. These videos are for informational and educational purposes only. Now, seeing the wrong doctor can result in an incomplete diagnosis, the wrong diagnosis, wrong treatment, and persistent pain with poor recovery or no recovery. And that is not where anybody wants to be. So let's jump in briefly and discuss this topic on MRIs and chiropractic care. I'm breaking this into two video parts. This first one, we're going to discuss the role of chiropractors in MRI. The second part, we're going to discuss an actual case example where an MRI changed the diagnosis, that then changed the treatment, and then the patient got much better results. So let's go ahead and get started. The summary of this first video is very straightforward, and I'm going to give it to you right now. Chiropractors should order more MRIs, and number two, chiropractors should learn to read their own MRIs. So let's get into the details to discuss this. Why do patients need MRIs? Well, very clear cases. If they have new pain or weakness going down their arm or down their leg. If they've got changes in their muscle strength in their arms or their legs, their reflexes, or if they've got sensation changes. If they're failing to improve, if they have an unusual pain pattern that is not typical for what one would expect for the diagnosis that they have. And then there's other guidelines where there's other conditions where we could order those. Now, some clinicians actually order too many MRIs. However, chiropractors are not typically part of that profession. They usually don't order enough MRIs. And that's the primary issue. So why don't they order enough MRIs? Well, the first reason is they're not trained to order them as part of their chiropractic curriculum. Also, they're not trained to read them once they do get the MRIs. They rely on the report. So you have to do postgraduate training in advanced practice. And a lot of chiropractors don't go on to do that after they graduate. Now, there was a paper that was published in the BMC Musculoskeletal Disorders that looked at low back pain and radiating pain going into the leg. And they found that chiropractors were actually ordered way too little. Now, the other problem is that a lot of doctors, including chiropractors, just rely on the reports. And that's not always that great of an idea. Why? If you go to the wrong facility and they got the wrong slice thickness, sometimes all of the pathology that's seen in the MRI is going to get kind of blurred together. Number two, if you read the MRIs and you read their actual images, you know that there's standard nomenclature, there's standard way of reporting. Sometimes radiologists may not report it accurately. Additionally, there's a couple of research articles, one in 2009, another one in 2017, where they saw an error rate in the MRI reports of right around 40% to 43%. That's not very good. So having a doctor that reads their own MRIs can bypass that. I remember a surgeon telling me once that I should learn to read my own MRIs and not just rely on the reports. And so that also prompted me to get the additional training. Getting an MRI can give me a more accurate diagnosis, can help me find a more accurate treatment, a more effective treatment plan for the accurate diagnosis. So if you're looking for a chiropractor, make sure you find one that can read and interpret their own MRIs. That way you're getting the best of both worlds and you get somebody who is embracing clinical excellence. Thank you for taking the time to watch this video. You have many voices to pick from. I'm honored that you chose mine. I truly wish you the best in your journey. And until the next time we meet, be blessed.